Now in the fifth and final section, let's talk about some special condition of heart. In this section, we will talk about the ischemic heart disease, mitral and aortic stenosis, Marfan syndrome, and pulmonary hypertension. First, the ischemic heart disease. As the name shows, ischemia is the condition in which there is decreased supply of oxygen to the different parts of the body, and mainly if you see in this, the arteries are occluded or blocked by the deposition of fatty deposits. Can cause narrowing of the blood vessels, and this can cause ischemia or ischemic heart disease. Uncommon in pregnancy, ischemic heart disease occur more in women with type 1 diabetes for over 10 years. Type 1 diabetes is the insulin dependent diabetes. So women who have insulin dependent diabetes, ischemic heart disease is common in those. Treatment is percutaneous transluminal coronary angioplasty and thrombolytic therapy. So thrombus is also formed as a result of deposition of fat inside the blood vessels, and thrombolytic therapy can be given to destroy or dislodge those thrombus. And then we have angioplasty to open up the blood vessels can be performed. Diagnosis is performed by stress echocardiogram, thallium scans, dobutamine echo testing, and then coronary angiogram. Angiography is performed, and if there is any blockage of the blood vessels, usually angioplasty is performed to open up the blood vessels. So this is ischemic heart disease. Then mitral and aortic stenosis. Mitral valve and aortic valve are present in the aortic valve is present in the aorta, from where the blood goes from the left ventricle into the aorta. Aortic valve is present there. Then we have mitral valve between the atrium and the ventricle. So whenever there is stenosis or narrowing of these valves, there is backflow of the blood, and this backflow of the blood causes pressure on the heart, increased pressure, and there it can be reflected as a result of increased pressure. So obstructive lesions is the risk factor. Then aortic stenosis is congenital. Usually it is present at birth. Mitral stenosis occur as a result of rheumatic heart disease, and after rheumatic heart disease, mitral stenosis can occur as a complication. Treatment of stenosis is reduced heart rate, bed rest, oxygen therapy, beta blockers, diuretic therapy, and then there is balloon mitral valvotomy, in which the valves are dilated to decrease that stenosis. So reduce heart rate, bed rest, oxygen, beta blockers, diuretic therapy, and balloon valvotomy are performed. Marfan syndrome is another condition which is autosomal dominant connective tissue abnormality that may lead to mitral valve prolapse and aortic regurgitation, aortic root dilation, and aortic rupture or dissection. So all these complications can occur in Marfan syndrome, which is autosomal dominant condition which affects the connective tissue, leads to mitral valve prolapse and regurgitation, aortic regurgitation, and also dissection of aortic root dilation and rupture or dissection. Here, this is the dilated aorta. Here, this aorta, it becomes dilated in Marfan syndrome. Echocardiography is performed for investigation. Echo is like the ultrasound, in which the ultrasound of the heart is performed, which gives all the information about the blood flow, any stenosis, and any prolapse or regurgitation. Complications are early pregnancy loss, preterm labor, cervical weakness, uterine inversion, and postpartum hemorrhage. These are all the complications that can occur in patients who have Marfan syndrome and pregnancy. Pulmonary hypertension is increase in pulmonary vascular resistance, resulting in increased workload placed on right side of the heart. So from the right ventricle, blood goes into the lungs to get oxygen by the pulmonary vessels. So this increase in the resistance of pulmonary vasculature cause increased workload on the right side of the heart, and this is pulmonary hypertension. Treatment is endothelin blockers, bosentan and phosphodiesterase inhibitors, for example, sildenafil. Symptoms are fatigue, breathlessness, and syncope is common in patients with pulmonary hypertension. So that was all about our lecture topic, kidney and heart disease during pregnancy. What are their effects? What are their complications? What are the risk factors, and how these conditions can be managed and treated during pregnancy. So thank you for watching sqadia.com.